Hi, this is Grace again. So, I'm a registered nurse and I currently work in the peri-operative. So, peri-operative is anything dealing with the surgical process. So, we have the pre-operative phase, we have the intra-op phase, and we have the post-op phase. I pretty much work in pre-op as well as the post-op. So, one of the things that I really want to share with the general population is about when you first know that you are going to have surgery. I just have a tip for you. If the doctor prescribe certain tests and lab work and consults for you, it's critical for you to follow through and get these things done on time. The reason why I'm saying that is most of the lab work and tests take time, and decisions need to be made about your surgery. Equipment needs to be obtained. Um, Based on your lab work, further consultation and referrals needs to be made. So if you don't do this on time and just sit on it, say if your surgery it's we are right now in February, if your surgery is scheduled for March, and the doctor gives you a slip for lab work, and you think, oh, I have a 20th March surgery coming up, I'm just gonna wait a week or two before I do my lab test, that would be a bit too close. So it's best to always do your lab work right on time and get this done over with so your doctor will be able to review it and decide on what, if any other actions needs to be taken on your lab test. They will be able to do that and get you cleared for surgery. So that's one tip I always give to my patients. And also, when you are going in for your consult, go with a loved one. Come in with a loved one, somebody, a friend, neighbor, anybody, a church member, sibling, loved one, anybody. The reason why I'm saying that is it's sometimes patients are overwhelmed, especially if they know they are going to have a procedure done or even any consultation, any referral. When you are with someone, it gives you the moral support, it gives you emotional support. You are not as nervous. You know that somebody is um, accompanying you, and the person will be a second eye or a second ear to what the doctor or the team has to tell you. There's a whole lot of explanation of why you need surgery, why things needs to be done, and it can be very overwhelming. So when you have somebody with you, they will be your a support person to kind of facilitate, kind of help you through the process. One other reason why it's important, I as a nurse, a pre-op nurse, telling you when you go in for your pre-operative consultation, is that when the doctors know that there's somebody with you, it's not like they will do their best work anyway, but healthcare professionals in general are a little bit more attentive. I'm giving you a secret, a little bit more attentive when a loved one is with you. Uh, Not that they will not do a good job anyway, but having a second person with you kind of keep them on their toes and know that they have to be on top of their game and do the right thing for you. That's just one secret I'm giving you. We do our best anyway, but having a loved one come in with you really, really helps and make sure that they are doing good by you. And also, it just also, just like I said, and I don't want to repeat myself, it really helps, you all the information that you need to gather, all the tests you need to go through. It just helps to have somebody with you and help you go through that process. And on the day of your surgery, come with a person. Don't drive to the hospital thinking, oh, I'll have a friend come in and pick me up. I'll leave my car in the garage of the hospital and come in with a person. And I'll follow this video with a second part of what needs to be done during the actual pre-op phase on the day of your surgery. And I hope you watch that. That will be a part two. Thank you.